Yep, we're good. We're live.
Hi,
Hi.
Hello,
I'm James,
I'm Mike Willis.
I'm Kandice.
and this is
The Power.
Half an hour.
yeah. So we're coming to you live from Chase Brexton in Baltimore, Maryland, from our Mount Vernon location. And what we plan on doing is just talking to everyone about what is going on in the world today. You know, dealing with sexual transmitted infections, HIV, hepatitis C testing, linkage to care and stuff like that. So today we're going to start off with what's going on in the world. Generally, is COVID-19, right? So everybody's really concerned about COVID-19 and how to stay safe. We're not 6 feet, but we are taking precautions to stay safe and everything. And we want to make sure that the clients that come in to see us are staying safe as well. And one of the big concerns that we here at Chase Brexton, because we work in the social work and outreach department, and we are part of the Power team, and our specialty is PrEP and PEP,
Yeah.
HIV, counseling, testing, referrals, hepatitis C, and linkage to care.
Sexually transmitted infections.
And all of that. So we do all of that here. And so we wanted to talk about COVID-19 and how that is affecting people today, especially with not being able to closely engage with some people, loved ones, and everything like that. So Mike, what are you hearing about COVID-19 and say like HIV testing?
So I'm hearing, I don't think people know that we are still here every day from 9 to 5, and we offer testing to anyone. You don't have to be a patient here. You can walk in off the street. We also still have our Power Clinic on Tuesday and Friday afternoon, which is a clinic where people can be prescribed PrEP, which is the medication that people take to keep themselves from being infected with HIV. That clinic is still up and running. It might take a little longer to get it in the moment that it normally does, but we'll get you in as soon as possible.
Cool, that's great.
Yeah.
And Candice, what about you? What are some of the conversations that you run into?
I'm kind of hearing the same thing. People want STI testing. People want HIV testing, and people are unaware of PEP.
Right.
People are unaware that if you do have an exposure, you can come into here, Chase Brexton, or any emergency room in Maryland and get PEP, so that you won't get HIV.
Is there a window for that?
You have 72 hours to get here or any location in Maryland. You'll be prescribed medication for 3 weeks so that you won't get HIV. Most people don't know about that. People also are not aware that if you don't have insurance, you still can come in here and you'll walk out the door with the prescription.
That's
You'll
good,
still get the
right?
medication.
Yeah, and that's a lot of people don't know that. And that's one beautiful thing about Chase Brexton is that we try to go above and beyond the call and duty for a lot of our clients, right? And we know about all of these great programs that will assist, clients in getting the services that they need, especially when they can't afford it. Because we deal with a lot of marginalized populations and stuff, so sometimes people come in and they don't have insurance or don't have the money to pay for prescriptions or co-pays and stuff like that. And the beauty of Chase Brexton is that we find ways to assist our clients and stuff, which is good. Conversations that I've been having is with COVID-19 that people are afraid to have sex. And because there's so many theories about the COVID-19.
How it's transmitted.
How it's transmitted? Is it airborne? Can you get it through Can you get it through sex? If you're not using protection, and here we encourage protection, right? We also give out free condoms as well. But a lot of people are afraid, to hook up per se to have sex and stuff like that because they don't know what is going on. And like Candice said, a lot of people are looking for the STI screenings. And unfortunately in Maryland right now, because of the shutdown, there's no place that's doing a full STI screening unless you're a client of that particular facility. But one thing I did hear from John Hopkins is they have something called iwanthekit.org where you can go and order a sexually transmitted infections kit to do the testing. Only thing it doesn't include is syphilis because that's a blood draw. But so that's one way that people can get sexually STI screening is with iwanthekit.org. What in some of your social settings, how is the conversation of PrEP being brought up, if it is? Because you spoke about PEP, because a lot of people don't know about it. I know that a lot of people, even some medical providers, still are not aware of PrEP.
Yes.
So what are some of the conversations that you hear in your social settings about PrEP?
About PrEP, people believe heterosexual people don't understand that it's also offered to our community as well. The pill is available for heterosexual, homosexual. It doesn't matter your sexual orientation. If you're a human being, you can take PrEP and PEP. People are unaware of that.
Yeah.
Mm-hmm.
So that's good, Mike.
The other thing I hear quite often when testing people is that people have been scared off of PrEP by ads on Facebook from lawyers that say that people are, having terrible complications from Truvada. And while it is true, there were some people who did have some complications from Truvada. The newer medication that people are starting now is called Descovy. It has far fewer side effects. And even with Truvada, those side effects that the lawyers are trying to get business on are very much overblown in those ads.
Yes.
And people who already had kidney disease might have a worsening of kidney disease, but it doesn't cause kidney disease.
Right.
And it's not causing people's bones to snap. And for somebody who's at risk of getting HIV, being on Truvada is so lower risk over the course of life than actually becoming infected with HIV.
Right.
You don't want to get HIV, even though, it's a different disease than it once was, but you still got to take a pill every day. And it's not without consequences. Socially, financially, emotionally.
Right.
If you can stay HIV negative, you got to do it.
You got to do it.
You got to do it. You'll be sorry.
Right.
If you don't.
And that's true. And you said something about taking a pill every day. That's something I have conversations in my social settings. Even with clients, I always give them the option of weigh it out for yourself. Would you rather take a pill to prevent you from having HIV, or do you want to take a pill every day because you have HIV? Which option sounds better to you? Theoretically, for me it would be to take the pill that will prevent me from having HIV, because let's be realistic. We are all adults, and a lot of times, often than not, people are not using condoms when they're having sex, right? The realistic side of it all, right? So why wouldn't you want to take something, or at least investigate and research something that could for yourself that will that will prevent you from contracting this disease, this HIV and AIDS and stuff? Because people's minds is, oh, if I got gonorrhea, if I got chlamydia, if I got syphilis, I can get a shot, I can take a pill and it's gone. HIV is not the same way.
It's not going away.
It's not going away. And in my experience, I've learned that HIV, although it's medical, might be more mental. People, it's hard to wrap your brain around the fact that you are HIV positive. And that's another good thing here at Chase Brexton, that all of us have been trained professionally and personally in dealing with matters like that, and talking somebody into taking care of themselves and the benefits of taking care of yourself if you are impacted with HIV, and to give them information and direction on how not to become HIV positive. So, I think PrEP is a beautiful thing. Had we had that 30 years ago, or had people known that the medication that they use for HIV care could be used for HIV prevention, how many lives would have been saved? So today, especially in the African American community where it's so high prevalent, why not? Why not? So that's our job between the three of us and amongst our coworkers, is to make sure that we get that information out to people as much as we can.
You know what else I hear people say is that they think that if they go on PrEP, they have to stay on it forever. And it's not true.
Right.
You can go on it when you're at a time in your life. Say you're out there and you're having sex with a lot of different people. You're not using condoms. That's the perfect time to use Truvada. But if you get a little older, things calm down a little bit. It's not quite as there's not quite as many guys knocking at the door.
Right.
Well, at that point, you could go off the Truvada. Right.
True. True.
Yeah.
So with that and everything, I see that a lot of people are still concerned about it, and some people are still doing risky things and stuff and everything. So again, it's our job to make sure we get that information out to people and make sure that they understand fully what it is that is out there that can help prevent HIV, right? And that's a big mission here at Chase Braxton, also to link everybody. And that's another thing that people sometimes get misconstrued about Chase Braxton. We're just not a center for people who are impacted by HIV. We are all around.
It's like a one-stop shop.
One-stop shop.
Everything your body needs, Chase Braxton have it here.
Right.
If they don't have it here, they help pay for you to go somewhere else.
Name
So,
a few things that we do here.
Dentist, nutritionist, behavioral health. What else?
Lab,
Lab,
pharmacy.
Pediatrics,
yes.
gynecology,
Mm-hmm.
just your primary care physician.
See children here as well?
Yeah, right.
Yeah, you said that.
Yeah, and like we said, social work and outreach, which is case management for some people that might not know. So we do everything, right?
Yes, whatever your body needs is in one building.
Yeah, one building.
It's in one building.
Right, and
in one
it's a
building.
beauty because who wants to run around here? Oh, I gotta go here to go to the pharmacy. I gotta go see this doctor because I got a problem with females that have certain issues, and their primary care physician doesn't take care of it. Then they have to go see an OBGYN specialist. We have all of that right here. So Chase Braxton again, and then we have how many locations?
5.
Five locations.
Glen Burnie,
Mm-hmm.
Columbia,
Mm-hmm.
Randallstown,
Mm-hmm.
the Eastern Shore,
Yep.
and right here at Mount Vernon.
Numero.
Three things, if you go to a doctor here, all doctors can see your chart. So the idea of having to transfer files and wait for the new doctor to get your old records, everything is already here. So if you go to a doctor here or Randallstown, they still can see the same chart. They still have access. So I think that right there is priceless.
It's
Yeah.
all of it in a nutshell. You can't ask for anything more, right?
Yeah.
And then Chase Braxton. And then they always are very, very, very client based, right?
It's free parking.
Free parking.
Free parking. You
We
can't
do
beat that
everything we
in
can
Vernon.
for park, right?
Yes.
For our clients and stuff like that. And that's what I also love about Chase. I was telling Candice earlier, they're gonna have to take me kicking and screaming for this job. You know what I mean? Because it's not only for the clients but for the employees. They do try their best to accommodate their employees as well. And I think if you have happy campers, the campers can also go out and do the work to make sure that the campgrounds are still intact. You know what I mean?
How do people, if people want to get that kit for STI testing, how do they go about getting it?
So again, you go to the website and it's iwanttokit.org. So you go to that website, to that link, that website, and you sign up for it. They mail it home to you. You follow the instructions, you put the packaging back inside, and they have a return label and everything for you. They send it back out, and you get your results via email.
Email, okay.
Yeah, so it's a great thing. Again, it doesn't come with, I believe it's syphilis because it's a blood draw. And, they don't want people at home drawing their own blood, for fear that something...
I'd rather not do that. Yeah.
So that's a good thing. And then a lot of organizations in Baltimore, Maryland itself have that link to that website. So not just Chase Braxton, but everybody is uniform for that. And
another way, I guess you could get STI testing here, either if you're a patient or if you're in the PrEP clinic.
Correct.
And we still are taking new patients in the PrEP clinic. I think I might have said that before.
But it's good to reiterate it. We are.
Yeah.
We are Tuesdays and Fridays from 1 to 4. Call us at 410-837-8813 and to schedule an appointment for PrEP, right?
2050.
And then extension.
8813.
Oh, okay. One day I dialed the 8813 and went straight through.
Oh, really?
Might have been a glitch, right? And so it's great that we can sit down and talk about our experiences from 3 different walks of life and everything like that, and we can be informative to the public. Any last thoughts?
I do want to touch on this. When I'm testing people in the room, they'll mention they want to go home. They want to go to test from HIV. I'm sorry, HIV test from CVS or Rite Aid. My advice is do not buy a test from HIV from Rite Aid or CVS. Because if you find out the results at home, what do you do next? If you come in to Chase Braxton, the test is free of charge, and people around you know what to do next. You have social workers, you have doctors, you have a lab here, so it'd be best interest to come in versus finding out at home, because what do you do next?
Right.
So come into here, whether you have insurance or not, come into Chase Braxton and get your HIV test.
Right, because we don't want you to be alone with something like that. That's very difficult. That's some really heavy stuff to take in by yourself, and we have the trained professionals here to help you through that process, and we like to get familiar with our clients, you know, to understand, because not only do we work in this field, but that impacts us as well. So we understand what you might be going through at that moment. We probably can't say, I know for sure, if we're not ourselves impacted with the same situation, but we definitely understand and we definitely can help out. Definitely.
And also, once again, with the PrEP, the advertisement does not show, people say they have not seen women on the PrEP commercials.
Good one.
But there's transgender, so I think people focus on, that's a natural born woman, and just because you don't see in the commercial does not mean that you cannot take the medication. I think it's a misconception that it's not for women, and it is. It is for all women.
Right.
All women can take
And we
PrEP.
want to touch on that too, because Mike talked about the new medication, Descovy, for PrEP. Right now, cisgender women cannot take the Descovy yet because they're still in trials with that, but they definitely can go on the Truvada, and still the same thing. Monitor your activity, your time on the medication, make sure everything is cool and copacetic. And like Mike said, you know, especially here at Chase Brexton, we've had maybe 1 to 3 to 4, don't quote me, percentage of people that might have came off of PrEP due to some internal complications. But like Mike said, it was pre-existing conditions that a person was dealing with. So you definitely can come here and get more information for our ladies and young ladies out there who want to get on PrEP and to protect yourself, because people aren't honest.
They're not honest. And someone else should not be in control of your health.
Yes.
So even if you believe the person, they're only with you, is that enough? Like, is that just enough for you to be comfortable with someone saying it's just you? Why not protect yourself so that you know you're protected?
I agree.
I don't think it's worth the risk.
No.
Years ago, people used to say, you know, talk to your partners before you have sex with them. But what that advice ignored is the fact that people will lie to you.
Yeah.
And they'll look you right in the eye and lie.
Well, they don't even know about their own health. So
They don't know.
maybe they haven't been to the doctor in 3 years. So how can they tell you? They really don't know.
Yeah.
People are afraid of needles, so they don't come get tested. They don't get labs done and stuff. So, you don't know. Like you said, you can lie during that conversation. So always take responsibility of your own life. Don't put your life into somebody else's hands when you yourself can control that narrative. You make that decision. It's like when they say for women, or anybody, that when they be like, no is no, your health is your health. Take precautions of protecting yourself, because we don't live, like Kandice said, we don't live in that day and age where we can say it's your fault, blaming the other person. We have to take responsibility for what happens to us. We have to take that initiative and that step to say, hey, either we stop and we get a condom, or hey, maybe we don't do this right now, or whatever the case
Because safe
is.
sex feels good too.
Yeah, it does. It does, and it saves lives.
Yes, it definitely does.
You know what else I hear people say sometimes when they talk about going on PrEP, is they say, well, it's too expensive. And if you come down here, I mean, if you go to a private doctor, they're not likely to know the programs that exist to help people get on the medication, because there's copay assistance that pays a lot of money per year. What's the amount? $7,500 a year toward copays per person. There is patient assistance programs for people who are uninsured. We can also, refer you to insurance here if you're eligible and don't know about it. So when you come down here, we're not going to say, oh, tough. We're going to figure it out.
We're going to figure it out.
We're going to figure it out.
Insurance, uninsured, undocumented, it doesn't matter who you are. Chances are we can get you PrEP.
Yeah, right.
Yes.
That's definitely right. That's right. And even if you are impacted with HIV, same thing applies. We can get you hooked up with the insurance, with the medical attention, with the medication that you need. That's what we do here. We go that mile to make sure that everybody is taken care of the best way that we can. Right? So anything else, guys?
I have a question.
Sure.
Okay.
The cameraman has a question. So, can y'all walk us through, like, if I want to get an HIV test, what do I do, like, and how do I get hooked up with Chase Brexton?
So you come in for now, during this COVID emergency, we have shortened hours. We're only open 9 till 5. So what you do is you come to the front door, you're screened to make sure you don't have any symptoms of COVID, and then they'll give you a wristband. You'll come on up to the 6th floor, get off the elevator. This is for downtown. Get off the elevator, come to the left, and you come in and you tell the person at the front desk, hey, I need to get tested for HIV. You register, and we do anonymous testing. If you don't want to give your name, you don't have to. If you do test positive, we would like to help you get into care. So if that were to happen, we would hopefully get your name and your address so we can help you, but you can still say no. I mean,
It's your choice.
Yeah,
it's your choice. Yeah.
Self-determination.
So you come in, you'll wait a few minutes, and then someone will come and get you, take you to the back. You'll discuss what's going to happen in the room, which means you have to sign a consent. We do some education about HIV. We ask you some questions. If you were to test positive, what would you do?
Right.
Where are you going to go? Do you have someone? Do you feel like you have support? Then we do the test. While we're waiting for the test to the results to come, we'll do a questionnaire with you where we assess you for risk factors, including sex, your sex practices, alcohol, whether you're using any substances, and then you get a result. And of course, we always hope that the result comes back negative. If it does, and you say, "Hey, I want to get on PrEP," I go get my laptop and I'll get you on the schedule before you go.
Right.
And sometimes people do it the same day.
Right. How long does the result come back?
Before the test result comes back, minutes.
Minutes.
Yeah.
It is so fast.
Yeah, it's really quick.
Before you can get nervous, you already have your results.
Yeah.
Yeah.
For people who are HIV positive, which does happen, we help you get into care. We hook you up with a case manager so that you can get an assessment. If you don't have insurance, we figure that out. If you don't have a way to pay for medication, we figure that out. We work with everyone who comes in the door, and we want them to leave with what they need.
Exactly. Any other questions?
And is that a blood draw that you do?
It is a little, it's like testing yourself, your sugar, diabetes. It's a little bit of a stick. It's a lancet, and you go bing. And I think that people tend to dread it, and I think that the feeling of it is a lot less.
Right.
It's nothing compared to what people are worried about.
Right.
Yes,
It's
yes.
it's 1, 2,
Yes.
3. Pop.
Yeah, because people go like,
Yes.
tighten their whole body before they get it, and then it's over, and
Right.
they didn't feel
They're
anything.
like, oh, okay.
Yeah.
We draw that little bit of blood, put in the solution, wait a couple of minutes, and bada boom, bada bing, you got your results.
I mean, when you're talking about like the people think it's going to be worse than it is, I think that the same is true of medication now too. Is that in the community, I think there's still this talk that this HIV medication is going to just make you sick. It's going to tear you up. You're going to have diarrhea. You're going to be running to the bathroom. You can't leave the house. It's not true anymore, people.
Right. That is so true.
It's
not.
like you take the pill and then you wait for the side effects and they don't come.
They don't come. That is so true. True. Any more questions from our audience?
I don't see anything.
Okay. Do you guys have any questions? Anything that you're not sure of that you want to tackle?
No.
No?
Say that website one more time.
I want the kit, KIT.org.
Okay.
So you definitely can go there, anybody, no matter ace, rage, religion, creed, whatever. I want the kit, KIT.org, and you can do a free STI screening through that. Again, syphilis is not included because
Okay.
that's a blood draw, but HIV, gonorrhea, chlamydia, I'm not sure about hepatitis C, though. I gotta research that, I believe, but I know those three definitely.
Is that for the whole state, that program?
State of Maryland, yes.
Okay.
Right, it is. We're trying to figure out if you live somewhere else, can you still get the kit as well? Because, like I said, it's a free thing that they mail to you. I think right now they're just mailing in-state because I presume that the lab is in Maryland itself, so it's easier to correlate those numbers around that.
Actually, we do have a question.
Yes.
If someone has Medicare Part D, what resources are available for older patients?
Okay. For PrEP,
Let's do both.
Okay.
Okay, so I just learned about this resource yesterday.
Good.
So if you have Medicare Part D, I know it's issues with paying for PrEP.
Right.
But the program Good Day covers it. So the person will have to pay maybe $15 for the prescription of PrEP. And one bottle is about a couple $1,000.
Like,
So
14,
just $15 if you
yeah.
have Medicare Part D.
Yeah. So if a person was HIV positive, then it's on care, right?
If they're HIV positive, then there's a program in Maryland called MADAP, which is the Maryland AIDS Drug Assistance Program. And that program is for anybody who's HIV positive and earning less than $63,000 a year for a single person.
Cool.
And if you have Part D, MADAP will help you pay the costs of all your medications.
Cool.
But you gotta be HIV positive for that.
Right.
For MADAP,
Yeah.
Yeah, I hope that answers the question, because we want people to get the things that they need. Definitely.
I think our half hour is literally, it's up. We're say goodbye and.
All right. Well, until next time, people. I am James,
Mike,
Candice?
and this is
the Power Half Hour.
and we'll be back with a new segment next time.
Yes.
See you then.
Bye, guys.
Thank you.